right. Looks like we are live. Well, hello, everybody. This is Dr. Darren Schmidt tonight. We're going to be talking about mitochondria. He's an expert on it. He impressed the heck out of me when we were at an eco up at Cellcore with all of his knowledge. I'll let him introduce himself with his accolades and what he loves to do. And then we're going to dive right into the mitochondria. So get your questions going. I'm going to log back into Facebook to where I can see those. Once I'm able to finish with our talk here, we have some topics that we wanted to get out first. So Dr. Darren Schmidt, thank you for joining us.
Yeah, you're welcome. Thank you for having me. So I got into the mitochondrial subjects because I had black mold poisoning from my old office back in late 2015 through 2016. And what had happened was February 3rd of 2016, I had a horrible night. The mold was affecting my heart. My blood pressure was 155/95. My pulse was racing. I had bad thoughts, anxiety, and my body was cold. My feet were swollen. And so what happened was right after that, I took a couple supplements that I'm in the industry, right? I've been studying nutrition since 1993 and practicing it since 98. So I took these certain supplements that were actually designed in the 1930s, and I felt better. I'd been trying to fix it for 5 months prior to that. So I had to find out why those supplements worked. Now, they didn't fix the mold. They didn't address the cause. They're actually fixing the mechanism. And so reading the material from the 1930s actually brought me into what we now know as mitochondrial function and, using ketosis to improve energy and to clean out fat out of the arteries and out of the tissues and to lose weight and all that. So the precursor knowledge, if you will, from the 1920s and 30s actually laid this really good foundation for me to figure out what people learn in school now. I think people there may be situations where people learn top level information without a foundation. And so I got piles of old books, medical and nutrition textbooks from the 20s, 30s, 40s, and 50s. And I just started reading through them, looking for similarities, looking for intelligence. I found a lot of it. And a lot of the information was pre-big pharma. So after World War II, pharmaceutical companies got really strong and they changed the education of doctors. They changed the way they went to drugs and away from nutrients. So when I figured that out, then everything made sense. And there's a mechanism of chronic disease where you're not using mitochondria. And your body, your cells are making energy outside of the mitochondria. And that actually leads to cancer, heart disease, diabetes, and all kinds of problems. And so that's what it comes down to, like, as far as being healthy, is how well do your mitochondria work? Is there garbage and toxins and stuff in your mitochondria preventing them from working? And of course, you want the cells to work well. So if you don't exercise your mitochondria, then you're setting yourself up for later a cancer diagnosis, a heart attack, something that surprises people, but there should be no surprises. So you should, exercise your mitochondria, get them working well to prevent, horrible chronic illness problems.
Gotcha. Well, I guess the first question to start off here is, what are mitochondria?
Well, these are little organelles that are inside cells and they make energy. The energy is called ATP. And there's like usually minimum 2,000 mitochondria per cell, could be like up to 15,000 in some cells, and some nerve cells will have, 100,000. So there's a lot of these mitochondria, and their energy production of ATP is a multi-step process, and it can be hindered by nutritional deficiency, such as iron, sulfur. It could be hindered by toxicity, such as a thing called heavy water. There could be other toxins. So that's what mitochondria, that's the best way to make energy, ATP, is with mitochondrial function.
Okay. Now you said that you can have a wide range of mitochondria, and something that's always interested me is what part of your body has more mitochondria in it? Because from my knowledge, it's the brain and the heart have the most, and the liver, right?
Well, I don't know how to really answer that question. When it comes to this, here's how I position it. That's a good question. I position it like this. What's the largest organ in your body? It's actually the muscles. So we have more muscles, pounds. We have pounds of muscles in our body, whereas the brain is only this big and the liver is, only this big. So the muscular tissue has more mitochondria than anything else just because of size. So I tell my patients, you got to feed your muscles first. And what's the best food for that? Well, it's meat. And if you're not feeding your muscles, nothing else has a chance. Like your little tiny adrenal glands, your little tiny kidneys, they don't have a chance if you're not feeding the muscles. So
I like
it's a
that perspective.
new way to look at it. Yeah.
It is. I like that perspective. I'm a big time meat eater. I love meat. I get a lot of clients in that are saying, should I go plant-based? Should I stay with meat? Should I go keto, carnivore? So I'm guessing that leans you a little bit more toward the keto carnivore with your diets.
Yeah, definitely. So I was keto beginning in 2015. I was low carb since 1999. So I was very strict for 16 years. I stayed below 75 grams of carbs a day. And then when I went keto, bring the carbs lower, and then I would come up. So I'd cycle in and out. But I've been carnivore for 2 years. And my rule is I eat as much meat as I possibly can every day. That's my rule. And it's been absolutely fantastic.
Well, you need to come down here to Kansas City sometime. We have all the steaks in the world. So someday take a vacay down here. But how is it that mitochondria are involved in chronic illness? Because, chronic illness is greatly growing, it seems like. It seems like everybody's coming down with something. And the topic of mitochondria even comes up in conversations with clients day to day for me now because they're such a big topic. So, how are those two things working together?
The subject of mitochondria and chronic illness. So let's do the bigger picture viewpoint of the food supply. So it's really high carb, and that's directed, it's designed by the USDA. And I've actually been involved with the dietary committee guidelines to try to get them to change it. But our food supply is just so high in carbs that there's always a supply of sugar in the blood. And plus, we're taught to eat 6 meals a day, like 3 meals plus 3 snacks. So there's always sugar, and that sugar is used. It can turn into energy outside of the mitochondria, and it's okay for athletes. It's actually better to be in ketosis so that you're using your mitochondria better. But let's say you're using sugar metabolism in the cells, but outside of the mitochondria for 60 years. You have lost energy, ATP. And you can have a loss of energy in the cellular level, so your immune system is squashed, and you've also like deposited fat in the places where it's not supposed to be, and over time, as your immune system is weaker, also your detoxification abilities are weaker. So the ATP that's made by the mitochondria has to be in adequate supply so that your cells are detoxifying on their own. And then also too, the ATP is used by the immune system to kill a wide variety of organisms. So let me give this example. So let's say you got a guy that's very athletic, very strong and quick. And so you can tell he's making a lot of ATP. But then he catches the flu for 3 days. He's in bed for 3 days. Well, he's still making the same amount of ATP. It's just not being used by the muscles. It's being used by the immune system. So the ATP is spilling out of the cells and into the blood supply. So I hope that answers the question.
Yeah, it definitely makes sense because so many people I work with will ask similar questions. They'll say, well, you say I'm getting better, but my fatigue is still bad. And I'm like, well, the immune system is partially regulated by the mitochondria, it's not on its own, right? So I tell people like the mitochondria have multiple functions. They're not just powerhouses. They don't just make energy. Without that energy, that mitochondrial function, we also have poor immune function. We can't heal, we can't detox. And if you're focused on healing and getting rid of infections and detoxing, then you're not going to be focused on being all energetic and up and moving around, right?
Right, exactly. Yeah.
So then bad mitochondria equals chronic illness because we're not detoxing all this metal and mold and plastic and all that kind of stuff out of our bodies. And we can't get rid of the just onslaught of viruses and parasites and bacteria that we're always getting from things like ticks.
Right, and mosquito bites, yeah.
All right. So let's get into the science a little bit here. I want you to break down the science a little bit for me. Tell me about how the electron function and how that relates to the mitochondria and in the body.
So in the mitochondria, there's a series of steps that are taken. Um, and there's 4 phases. And basically what it does, it's driven by electricity. And what happens is protons are shunted from one area across a membrane into, I'm going to call it a hallway. And so there's 2 membranes, and now you have a load of protons, and they get piled up in this hallway. And then there's a door that opens up into the machine, a little nanomotor that makes ATP. It's called ATP synthase. And so, but the point is that the protons need to be piled up, and then they're sort of just by mass action kinetics, they're pushed into this nanomotor. And this thing spins at 9,000 rotations per minute. Or is it per second? Oh my gosh, I don't remember. But how do you get all those protons across the membrane? And that's with electrons. So you got protons going this way and electrons going this way. And it's the movement of electrons this way with various cofactors such as iron and sulfur and electricity. And so as electrons go this way, it's able to get the protons going this way. So really it's a motor, just like a car engine, right? The car engine, I got a 1970 Buick Skylark. It's got a V8, it's got the distributor cap with electricity coming from the battery and then wires going to the motor. So you can't not have the electricity. And then it moves the pistons like that. So that's exactly what happens inside the mitochondria.
So, I'm always talking to people about mold and metal and all these things gumming up your mitochondria. I like to use those scientific terms there. So, when you're full of heavy metals and all of these other things that we're getting in, these elemental metals that are not designed by nature but by man, and you're living in a house full of mold, how does that affect this motor? What's happening? Are those things getting in there and actually sitting on part of that motor? Are they, what's going on there?
Yeah, there's the toxins get into the mitochondria and they'll sit right on top of that ATP synthase nanomotor. For example, there's a toxin called heavy water, also known as deuterium, and it blocks that from rotating. So you can have metals and chemicals that they have a different electrical field than what's supposed to be inside the mitochondria. So it's an altered field that's affecting the way that the electrons are moving down and the protons are moving this way. So it's a battle of EMFs. It's like, I mean, even now in the military, there's EMF warfare going on. It's not just bullets anymore, it's fields. So fields can be altered inside the mitochondria with things that aren't supposed to be in there.
So now you brought up a whole nother topic there. EMFs, right? Is this something that's leading to breakdown of mitochondria? Because I've seen clients coming in that smart meters put on their house, or they're blasting 5G through their homes due to their new box that they got for internet. How destructive is that to the mitochondria?
Well, there's plenty of destruction caused by that. So when smart meters were first put on the houses, I don't know how many years ago this was, 8 years ago, 10 years ago. I was very active in local government, state government, trying to stop it. And I talked about it on my YouTube channel. So I had people flying in from all over with EMF sensitivity. And what I found, to be honest, was that they were sick. They had fatigue already. They had mold in their house. They had mold in their body. So as they got better, they're better able to handle the EMFs. So it does matter that all the other physical factors are addressed. I like to give the analogy of a car battery. So if you have a battery that's totally dead, um, you got to change the chemistry within it, and then it works better. You see what I'm saying? You can do like Reiki on it, or you can like another battery next to it or something. But it's all about the chemistry inside that battery. So that's what I tell my patients now. Like, we got to work our butts off to get your body healthy inside, and then see how well you do with electromagnetic frequencies later. And I've had good success that way. And in the meantime, you still want to mitigate the EMFs in your house, the radio frequencies in your house, and take care of it that way too.
I find the same thing with EMS, but I also find that with mold too. I mean, if you can strengthen your body from bottom up, you can walk through a building that has mold and usually be okay, especially even for those mold sensitive people. It's if you're extremely vulnerable because of parasites and bacteria and other things, or too much EMF, too much radioactive elements, you're going to succumb to things much faster. Not saying that you can ever just live in a super moldy home, but if you can get the machinery operating at a great function, then you're able to adapt to so much more, right?
Right.
Well, we're just going to keep on going. We got awesome questions to go through here. So, do you believe without mitochondrial enhancement that you'd ever be able to heal from all of the onslaught of toxicities that we're dealing with in our society today? Or do you have to heal mitochondria specifically, directly, to heal from these other infections that we're dealing with?
I think you have to heal the mitochondria, or else the problems always come back. So we're always exposed to more toxins, and then we're always exposed to organisms, from the environment. And so you breathe it in or you eat it, and it'll settle in again. And then if you don't take care of the mitochondria, then you're always taking supplements to try to deal with what your body can't deal with.
Yeah, I completely agree. I'm always telling people, I'm like, our goal is to optimize your body, get it strong enough that you are able to defend yourself. You're able to produce energy. And yeah, I completely agree with you because I see it every day with clients. Once we get through all the infections and the toxins, get them all out, and then we finally get to that point where I'm like, okay, now we're really just going to focus on some fasting, some keto diet, some mito ATP. We're going to really just dive into those pieces. And and then you come out of that and they're like, well, I was able to be around somebody that was sick. I didn't get sick. I go, it's because your body is strong. It's not weak anymore.
Yeah, that's a good point. Yeah.
It's not to say you don't have to do some things to later on and do some detox or infection work. I still like to do a detox of metal with some HMET or something once a year just to make sure that I'm getting anything that's gone past. But
Right. And then plus you can get a really nasty organism such as COVID-19 from March and April. So you want to be super strong with your herbs and your diet and your mitochondria to prevent something like that. Or if you're going to walk outside barefoot, in the soil, there's going to be parasites. You got to be some of those parasites. It doesn't matter how strong you think your immune system is. You still got to do some anti-parasitic program later.
yeah, always keeping up, always staying ahead, keep up the prevention. So, what does mitochondria have to do with the anabolism, and why is it important, especially in tissue breakdown?
So it's a good question. So tissue breakdown. So anabolic means breaking down unwanted or breaking down tissue. When your body's in a state of an anabolic state, the first type of tissue it breaks down is the bad stuff: fibroids, cysts, like tumors, space occupying lesions. And so your body has to have the energy to break that tissue down. And that's kind of like the simplicity of it. Now, cancer cells are trying to kill themselves. They're trying to commit suicide, but their gear is out of control and they're splitting up, they're dividing fast. And when you have really strong mitochondria and making enough energy, it can supply energy to the cancer cell so that it can commit suicide.
Mm.
So that's just another example of like how anabolism is important with a strong mitochondria. And if you have weak mitochondria and you have no ATP production, all kinds of weird things start growing inside your body. It gets out of control.
So that means you're talking about a little bit that cell danger response, right?
Yeah. Yeah,
Which,
don't ask me more about the cell danger. I don't know that much about it, but that's
I would say we could go 2 hours on cell danger response, like Jay and Todd when we're talking with them. But a big piece of this, what you're talking about, is simply mitochondria allow for cellular intelligence by giving enough energy to do it. I mean, think about me or you or anybody. If you're so tired you can't function, you haven't slept for 2 days, you're gonna make mistakes. Well, that's the body, and that mistake, unfortunately, might be a cell getting away that has cancer.
right. So with the cell core products, they have fulvic acid and humic acid as the base for, which is, from soil, and they add energy to it. They add hydrogen to it, and it's filled up with electrons, and it's very energized. There's a lot of there's a lot of power there. So, but when you have, I've studied a lot of physics, and when you have a good foundation, such as a very strong fulvic acid carbon chain, that does a lot of things. It detoxifies, it provides nutrients, it provides minerals, but it brings order. This is a concept that not many people talk about. So when you look at, here's a little physics going on. So when you look at like a system out, like in space, a galactic system, all these planets are rotating in a circle like this, like our solar system.
Hmm.
There's order there. And the order is brought by the physics. It's the fields, it's the energy, it's the space. And it makes everything go like this in a circle instead of zigzagging or, whatever other design that it could be. It's this circle, there's order. But you can have a system where it becomes unbalanced. And so the part that's unbalanced goes shooting off and it creates a whole nother system. So it'll correct itself. And that's what these I got biotoxin binder here. So it's got fulvic acid in it. It brings order to the body. So it detoxifies, it provides nutrients, and it makes things smarter. It makes the body smarter. It makes the electrons work better. So it can find the unwanted tissue that needs to go away.
Hmm.
And at the same time, it'll enhance the healthy tissue. So it's intelligent. There's actually like a natural intelligence that's in these fulvic acid, supplements.
Yeah, I've found some incredible success with those, and specifically those, because I've tried some other fulvic supplements and it doesn't seem to be quite the same.
Exactly. Yeah, that's because they impart it with a lot of hydrogen, and oxygen, and they are adjusting it to make it stronger.
Ah, so that makes more sense.
Yeah.
Well, I've got lots of questions that have come up from a lot of different people that want to know a bunch. But one of the big topics that keeps coming up is, what is the difference between mitochondrial issues and adrenal fatigue? Where do you stand in that?
Well, there's been a few people that I follow on Twitter, and they say there's no such thing as adrenal fatigue, and because the adrenals are super strong. And I know a guy, he tried to treat his adrenal fatigue for 20 years. And then he detoxified with a product, and 6 weeks later, all of his energy came back. He was an expert on adrenal fatigue. He even bought a health food store, but he never cured himself until he actually detoxified. So when I had mold and I didn't know it, I thought I had adrenal fatigue. I thought a lot of things. I had postural orthostatic tachycardia. I had all these fancy names, but there's always a cause. There's always, and the causes come down to a finite number of things. That's the chemical, heavy metal, radioactive elements, and then all the different organisms that live inside our bodies, and of course, diet. So well, sometimes when I do muscle testing, I'll find the adrenals weak, and I can supply some adrenal supplements, but I'm absolutely making sure I'm addressing why they're weak in the first place.
Gotcha. I like it. I've said since before I knew about mitochondria being such a big deal, I've always told people, go, adrenals aren't just down for no reason.
Right.
There's something fatiguing them. It's not them, it's whatever else is out there. now understanding mitochondria better, like, well, if you kick those up, you get energy, then adrenals don't get so tired. But why are these down? Well, find a
Yeah.
root.
And this is a good like evolution in thought and education. So back in the 20s and 30s, people said that, yeah, if somebody has adrenal fatigue, you give them adrenals. And then Dr. Henry Harrow, the father of endocrinology, said, well, also don't forget to supply some pituitary and some thyroid. So
Mm,
like multiple organs, multiple glands, thinking bigger and bigger. But now we know even more with all the detoxification um, protocols and causes and all that kind of stuff.
gotcha. Well, let's jump into some practical takeaways here. So we've talked a little on diet, a little on supplement, but what is the diet that you give to your clients? I mean, you said that you do keto carnivore. What do you recommend to clients when they
So
come
it
in?
depends. I have the antifungal diet, antiviral diet. I got some people that are vegetarian. I have people that I just say, eat what you can to survive for the day because they're so sick.
Mhm.
And, it's like they can't eat red meat because it hurts their stomach. Fine, don't do that. And they have to eat white bread or something to give them some energy. So I'm like, okay, find the best quality white bread. But that I was at that point in 2016. Every day I was like, okay, what can I eat today to get me through the day? So it's a goal to get into ketosis. That might be 2 years later for some people.
Mhm.
And then I have a girl now. She's been with me at 3 months, and she had anxiety, fatigue. She's crying all the time, and I put her on some supplements for the first 3 weeks. And then I found that she had a problem with sugar. She was eating sugar. So I told her, "You're going carnivore right now. Just
Oh,
meat and water and salt, and that's it, beginning right now." And I saw her today, and she's doing absolutely fantastic. No more crying. She said she's 80% better. So, it depends. I have a lot of different diets that I recommend when I need to recommend them.
got it. What are your favorite herbs to work with mitochondria or supplements?
Well, the cell core supplements, and then ketosis as a diet. And then for herbs, I would say like rhodiola and ginseng, those tonics,
Mm,
the very popular tonics, like turmeric. But really, from Cellcore, the Mito ATP. I have a woman. She's been very, very sick for 15 years. She's been trying to get her health back, and she's very overweight. She keeps gaining weight. And I sent her some Mito ATP. She took 3 drops, and she slept for 2 days. She slept 2 days straight on 3 drops of Mito ATP. She
oh,
woke up. She got her energy back. She could cook dinner and wash the dishes and vacuum the floor in one night without sitting down. And so, like that Mito ATP grabs the heavy water out of the mitochondria to make those little nanomotors work better. So it's it, it, I should be paid as a salesman for Cellcore, but I'm not. I've never been paid by any company to do sales, like supplement promotion. But anyways, it's just been fantastic.
yeah, I have a love-hate relationship with Mito ATP. It's incredible. I love it. It makes people better. But man, it cranks on the mitochondria and stuff comes pouring out. And if they're not ready, it's just like, okay, let's get along for the ride. Let's get some biotox, some HMET, whatever we got to do to drain.
Yeah.
But it is an incredible product. I'm taking a ton of it all the time to work out because I love it. All
Yeah.
right. So we got your favorite products. We've got a lot of the diet portion. Are there any other pieces you throw in there? Do you have anybody that does emotional work? Have you seen that affect the stressors? Do we have any kind of energy work that you've seen work? Is there other pieces that you haven't mentioned?
Well, I used to do emotional work, energy work from 2000 to 2003 or four, and I was really good at it. And actually got a reputation in the Detroit area with a group of people. And it was a lot of fun. But the results, I didn't see the results sticking.
Mm,
Problems would come back, and then I made a decision to just stick with biochemistry and not do emotional work. And that's been very helpful. It delineates, like, here's where I'm at. I do biochemistry. We talk about diet and supplements, and that's it. I don't do any life coaching,
Mm.
etc. And so that's a relief for a lot of people. And so then as we fix their biochemistry, a lot of the emotional stuff goes away. Like I mentioned, this girl with her anxiety, and her constant crying. So and she's 80% better just in a few months. So that's just like a positioning decision I made back in 2004 or whatever. That with all my experiences with the energy work and stuff, I was like, this isn't it's not my calling. My passion and my calling back in 1995, I said I want to be a nutrition-based doctor.
Mm. I get you. I understand all that. I've definitely seen and done some energy work, some emotional work, and I much prefer to do anyway the biochemistry nutrition side myself. Um, I get that, yeah.
Yeah,
But it's incredible the amount of depression and anxiety that can go away by simply removing the layers of toxicity, infection, and infections, or shall we say mitochondrial dysfunction.
right. Yeah,
All right. Well, I think I want to go through a few questions from people. Is that all right?
yeah, sounds good.
All right. So I've got a lot, like I said, a lot of those adrenal questions, and you mentioned some of your favorite things there. Um, one question was, how does blood sugar affect mitochondria and fatigue?
Well, if you have high blood sugar for a long period of time, what happens is then you are not using your mitochondria like they should be used. And you end up, this is a word that I maybe should have said in the first question at the beginning of this, but the term is lactic acidosis. And that's the most common mechanism of chronic disease that comes from a high carbohydrate diet, like the standard American diet. And also like the bad vegetable oils that we have too.
Hmm.
So a high sugar diet, high glucose in the blood, also indicates you have high insulin, and that's diabetes. And diabetes is the number one cause of heart disease, and it definitely plays a role in a large amounts of cancers. So when you look at all across the United States, 91% of American men are overweight. Is because of the diet. It's a high insulin diet, high blood sugar, causing metabolic dysfunction, metabolic syndrome, name all these different names. And in order to reverse that, you decrease the sugar in your diet, which decreases the insulin, it decreases all the bad stuff, increases all the good stuff, and all this big mix, this whole big mix of all the things that get better. Your mitochondrial function will also needs to get better. Now, let's say with the standard American diet, people are eating at least 250 grams of carbs a day. Um, when you drop that down to, let's say, 100 grams of carbs or even 60, you're not getting into ketosis yet. You got to get down below 30 grams a day. So there is a threshold, right? You got to get below that threshold into ketosis, and now your mitochondria are starting to work better on their own with the diet, right? I mean, there's supplements you can take and all that, but you want to be able to do this with your diet too. So that's the technical part of it. That's the most technical part, is get your carbs below really 25 grams of carbs a day to get into ketosis.
All right.
And that reverses lactic acidosis. That like ends it. Now there is a point of this mechanism of chronic disease that where you can't reverse it. But if you're just chronically ill and you want to get your health back, your ketosis is very important.
Okay. Well, I've got a question here that goes perfectly with what you just said. Can your mitochondria ever fully recover?
Yes and no. So this this downward spiral of lactic acid. Okay, lactic acidosis is the excessive amount of using sugar as fuel and not enough mitochondrial function. Okay, so there are people who are using they're in lactic acidosis for 30 years or 50 years, and now they have a heart attack. They survive the heart attack, and now they have what's called cardiac cachexia. Cachexia is the lactic acidosis cycle. And what cachexia means is bad habits. Back in the ancient Greek time, bad habits kill people. They knew that in ancient Greece. So, and the same thing with cancer, cachexia, your body is wasting away. You can eat 2,000 calories a day and you're losing weight, you're losing muscle, you're losing fat. That's the lactic acidosis cycle spiraling out of control, like heading towards death. So, yes, there is a point where your mitochondria cannot recover. So, let me give this example. We have a patient in the office. She's been with us for a year. She was diagnosed with cancer cachexia. She had endometrial cancer that metastasized to other parts of her body. She's wasting away. And one of my practitioners said to me, "What do we do? I don't know what to do." And I said, "Well, when you look at, Dr. Weston A. Price of the 1930s, and you look at all these doctors that were very famous, saving people's lives, they brought with them raw animal food, whether it was like raw orange butter, raw cod liver oil, raw liver." And so this patient in our office, we told her, eat as many raw eggs as you can every day. So she was eating 2 dozen a day, raw, mixed up in a blender. She drank it. She had, various other things to make it taste good. It's been a year. She put her weight back on. She's got hardly any symptoms. She's not dead. The cachexia has been reversed by eating raw eggs. So she could have done it with raw, fish, raw liver, cream, stuff like that. So yeah, there is but there's other people where I've tried to help them with cachexia and I couldn't help them.
It's incredible information there. I love it. Something I don't hear very often talked about there.
Right.
Well,
nobody wants to talk about cachexia because it is the death cycle. And I don't know. I know this information because I studied the books from the 1930s.
Do you have any extra tips on gadolinium and detoxing it?
No, not really. I would say that the Cellcore products are so diverse in their effectiveness of detoxification and also supplying minerals. So when you look at the fulvic acid and the quantum physics and bringing order to the mitochondria, to the tissues, these products will actually look inside a cell or look inside the mitochondria and say, oh, you need some iron, or you need some some nickel. It'll make that metal or that element, it'll make the element and then donate it to the cell. So I asked the researcher who was explaining this, I said, how do you know this? And he said, well, this has been, known for 40 years. This is nanotechnology. I'm like, okay, I just never heard it before. But knowing that sort of story about how the nutrients, the fulvic acid will make nutrients and donate it, tells me that these nutrients, fulvic acid, will pull out anything that's bad, including gadolinium. So we don't necessarily have to target a specific metal or chemical. You just load the body up with these fantastic fulvic acid and humic acid products.
So my experience with that is I've seen oftentimes where just giving the CT minerals.
Yeah, formerly known as the bioactive carbon minerals.
Yeah, and then you'll see metal start coming out. You'll start getting metallic taste in your mouth. You'll start having other things where you got to throw HMET in to grab it up. But it's just minerals. No other minerals does this. I've tried 100 of them.
Yeah, exactly. Yeah.
You get that fulvic humic combination with the supercharged energy like you're talking about. Add the minerals to it, and it's just like a blast to the body that just allows it to grab hold of those minerals and that fulvic, and then let go of the stuff it doesn't want that's causing harm, because it's like an exchange. Like, here, have your gadolinium. I'm going to go ahead and take the magnesium or whatever it is that your body's needing in that moment.
Right. Yeah. So I have a patient in California. He had two symptoms. One is ED, and the other one is bags under his eyes. So he found an herbal combination for the bags. So that's like a cosmetic thing. And they said, okay, look, based on what we've talked about, you're toxic. So we can't just you can take Cialis. And he tried Cialis and it worked, but he wants to actually fix the problems. So I put him on Virachem binder and the HMET binder, and now his body smells like sulfur. His breath stinks. He goes to the bathroom and he stinks up half the house. He's been doing it for 2 months. I'm like, that's awesome. Keep going. You know, all that stuff is pouring out of him.
Yeah, I see stuff like that. I'll be like, take some biotoxin binder in high doses. Then they start smelling mold everywhere. Take some HMET. Everything smells like metal. They got metal taste. I'm like, okay, good. We're making progress. Here we go. Let's just keep pushing. How long am I going to do this? How much you got in you?
Right. So here in Michigan, you know, we've had this mask requirement for a while, and I have a medical excuse because of the black mold and some compromised lung function, whatever. I'm just not going to wear a mask. But I got to get my hair cut a couple times, so I go in with a mask, and I'm like, my breath smells horrible. So I asked my girlfriend, I was like, what's up with, does my breath always smell like that? She goes, no, it's different now. Just because you've been taking, you know, whatever. I got a new product from Socor. I've been taking that. And I'm like, well, this is reason number 2 not to wear a mask, because I'm detoxing. And I don't want to put myself suffering under the the smells from detoxification. It's part of life.
Yeah. So I've got a few questions here. Have you had any experience with POTS? And what have you tried? What have you done if you have to help?
Yeah, that's what I just mentioned a little while ago, the postural orthostatic tachycardia. So basically, like, you're sitting down and then you stand up and your heart goes, it starts pounding. So POTS means that you have, from head to toe in your body, something that's causing that to occur. Now, I fixed it before just with some nutrition, right? Like, I like Standard Process too. It's one of my other favorite companies, and they got some products that can help with that. But the question is, why do you have POTS? And in the medical field, they'll put you on a tilt table where you're laying on your back, and they'll tilt you upside down. Then they bring it back up and they test your blood pressure, and they charge you a lot of money. And they say, oh, you have POTS. Well, I had it, and it was from the black mold. So again, it comes back to, what is your cause? Is it Lyme? Is it heavy metals? Is it parasites? Is it, you know, you got to fix it that way.
Gotcha. Well, you did mention Standard Process, and you said there's some things they have. Is there any recommendations you can make there? Any favorites?
Yeah. So Standard Process is really good with feeding the organs and also addressing the mechanism of chronic disease called lactic acidosis. So these are the supplements that help me in 2016 keep my head above water as I'm looking for the cause being the mold. And so from Standard Process, I had a lot of experience and a lot of good results with POTS, and even what we've been calling adrenal fatigue, from Cataplex B and Cardio Plus and Drenamin. But my favorite was Cataplex G. So back in the 30s, there was a vitamin G, vitamin U, vitamin T, and vitamin S, and those names just went away. But vitamin G is actually a form of a B vitamin. It's a collection of B vitamins, and it's very calming. So with my racing pulse and high blood pressure and anxiety, that ramping up from the mold, the Cataplex G calmed all that down. So I was on 25 a day for 6 weeks, and I took it for almost 2 years as I was starting to detox with the biotoxin binder. So POTS, yeah, Cataplex G to help you along as you detoxify or get rid of whatever the organism is.
Okay. I've only got 2 more questions. I got one from the crowd and one from me. The last one is, how did you get rid of and test for your black mold?
I moved out. So, okay, I had the house in 2008, and then I had the office. So with the house, I didn't test for it. I just saw the basement flooded, and I pulled up the carpet, and I could see rings of dark circles from the previous owner. And then I pulled the walls off. They were like the wood paneling from the 1970s. pull those out, throw it in the dumpster. But there's this ring of black all the way around. And I was like, well, that's mold. And then the last thing was I saw it when I bought the house in the master bedroom. On the ceiling, there was this line of black. And I said, when I saw it, I was like, oh, that's candle smoke. My mom had the same problem in her house. So it was candle smoke. So they painted it. But then when I found the mold in the basement, like we're talking years later, I woke up one morning and I looked at that black streak and I was like, uh-oh. So I just went like this and it was all wet and slimy.
Oh,
So I remediated it myself. I threw away all that stuff that was infested with mold. I cleaned it. I used Kills paint on those cinder block. And then I hired a company to come in and bring in a whole new like basement walls and fixtures and stuff. So nothing organic. It's got to be synthetic stuff in the basement. And it's got to be breathable. So they use compressed insulation as the walls. Now regarding and then I moved out and I had an expert come in. I said, this is what I've done. What else should I do? I will hire you to do whatever else. He goes, no, you don't have to hire me. You did everything I would do anyways. So with the office, my landlord wouldn't fix it. So I just moved out.
okay.
Yep.
And the last question was for me. For everybody listening that wants to know more about you, tell us a bit about your clinic and then how to find you.
Okay, so the clinic is in Ann Arbor, Michigan. It's called the Nutritional Healing Center of Ann Arbor. So the website is the nhcaa.com. And so I've been in practice since '97, and I have 4 other nutrition-based practitioners. We have a doctor of pharmacy, a naturopath, occupational therapist, and then a food scientist, and they're all well-versed in everything that I do. We do the muscle testing, and we use the same products. We discuss, how to get people better. So I have a very strong team and administrative staff too. So on my website, I have courses that I've made. I've been on YouTube for many years. And then in June of 2019, YouTube attacked natural healthcare. So did Google. And they stopped any growth of my YouTube channel. So I had to go on, I'm embellishing my website, if you will. So I have one ebook on lactic acidosis, rediscovering the most common mechanism of chronic disease. I just did another ebook on The Office. I have a course on how to protect yourself from viruses. I have a course on called Follow the Physiology, how to fix lactic acidosis. I have a course on ketosis. I have a course on mold. And as a matter of fact, we just launched the mold course today. And then I have another ebook coming out, and I have about 20 more courses coming out over the course of the next 3-4 years. So I have a lot of material to put out. Yeah, trying to change the culture of healthcare, trying to make it into what we do, because what we do is, medicine's really good with the emergencies, but if somebody's sick for more than 3 months, you got to fix it, right? You can't just drug it. So I'm trying to change the way healthcare is delivered in the country.
Well, I love what you're doing. I love your knowledge. I've been absolutely blown away by especially all the lactic acidosis stuff that I've learned from you. I've watched some of your YouTube stuff. So thank you for putting all of that out. Is there anything else you'd like to say before we end the day?
I'd like to say that there's quite a number of people I've learned from, and with the Cellcore group of guys and girls, and including you. So as a group, you guys have had more success with these chronic illnesses such as autism and chronic fatigue and fibromyalgia. And then at that last company seminar, there's a team, the 2 women doctors, I forgot their names, but they actually had a case of Parkinson's that got reversed. I've never heard of Parkinson's ever being reversed, but they have the lab test to prove it. They got, of course, the symptomatology went away. So I'm saying this because it's like the new, and I've studied a lot of mentors, but the group of Cellcore practitioners is like the next group to learn from and like to master everything that you guys are doing with the supplements and implementation. of the supplements and that kind of stuff. So it's a new era, if you will, and especially with the quantum physics that they incorporate into their products. It's really exciting. And so I appreciate you and the group, the Cellcore group. So look for the next, many years of collaborating and sharing knowledge and results.
I look forward to it too. I love it. I've had so much fun with all these guys, Jay and Todd and Stephanie, Dr. Jess, and that was Elena Venezuela, something like that.
Yeah. And
That
Alan,
we're talking
yeah,
about. Yes, just incredible people. We just call each other. I can't tell you how many just call me and they're like, "Hey, I got this kid. What are we doing?" I'm like, "Here you go. Here's a protocol. I texted one out at midnight last night." So, we just want to help people, heal people, like you said, make courses, make information available so that people can get well.
right. Exactly.
Well, I want to thank you so much for being on here with us tonight. And hopefully we can do this again someday because your information is incredible. So have a great night.
Thanks. Thanks, Javen. Take care.
You too. Bye.
Bye.